Monday, October the 18th. Today, we're going to start with some opening statements from our CEO, Nicole Dupuis, and then we'll move into media questions. Thank you.
Good morning, everyone. It has been almost 4 weeks since Ontario required proof of full vaccination status to access certain businesses and locations in the province. Last Friday, the Ontario government announced the rollout of the enhanced vaccine certificate to make it easier and more secure to provide proof of vaccination. The enhanced certificate includes a QR code on an individual's vaccine receipt, which can be downloaded for Ontario's from Ontario's COVID-19 vaccination portal. The code can be saved on an electronic device, or such as your phone, or printed for use, and both versions will be accepted. Individuals were able to start downloading their QR codes in a staggered approach over the weekend, starting on Friday. As of this morning, the system is fully open for all Ontario residents, regardless of birth month. It's important to note that an individual can continue to use their original receipt in paper form as their proof of vaccine status. Whether you use the original receipt or the enhanced certificate, matching identification must be shown where required. Those who are unable to download their certificate themselves can contact the Provincial Vaccine Contact Centre to have it mailed or emailed to them. The centre can be reached at 1-833-943-3900 from 8 a.m. to 8 p.m., 7 days a week. Receipts are also available at local libraries, Service Ontario locations, or by asking a friend or family member to print it for you, or a trusted organization to print it. For those who do not have an Ontario health card, you can contact the WeChew at 519-258-2146 and press 6 to book an appointment to have your identity verified, and you can get a COVID ID, which is a unique number assigned by us at the health unit for the purpose of obtaining a copy of your vaccine certificate online. I would like to thank our community members and businesses who continue to follow public health guidance and have made so far the proof of vaccination program successful. As Ontario lifted capacity limits in a number of businesses and organizations, it's important that we all continue to follow these guidelines. Getting vaccinated is a key factor in protecting yourself, your family, and our community as a whole. Our vaccination rates have slowed in Windsor-Essex, and we continue to be below the provincial rate of fully vaccinated residents. We want to encourage everyone to get vaccinated. If you have questions or concerns about the vaccine, please speak to a healthcare professional or visit our webpage or call us for answers to commonly asked questions. Our webpage will also connect residents to the Ontario COVID-19 vaccine portal so you can access your enhanced vaccine certificate. Thank you, and we'll take questions.
Thank you. We will take opening questions from Windsor Star.
No questions at the moment.
Any questions from AM 800?
Nicole, I'm just wondering about the school outbreak at, I'm just pulling it up here. It's the French school that was closed, Louis Caron. Is that school still closed, or has the health unit allowed students and staff back in the building?
That's a good question. I don't have an update on that school, but I'd have to get back to you, Rob.
No problem. Thank you. That's it for now.
And any questions from CTV?
Yes, good morning. Has the health unit been fielding a lot of questions so far about the vaccine QR code?
We have been fielding a lot of questions about vaccine and, printing your receipt, obtaining documentation and the QR code, honestly, before the announcement on Friday. Since Friday, I don't have an update as far as, how many folks have reached out. But we have continued to have questions all along and continue to support the community on, the best way to get their receipts or obtain their information.
Okay, thank you.
Any questions from CBC?
Yes, good morning. I'm not sure if this is a question you can answer, but
do you have a sense of what our local COVID-19 testing capacity is? And how many of the tests that people get at the hospital, if any, end up processed through the local private labs?
Go ahead, Dr. Schenker.
Yeah, so we can get you the number of people being tested on a daily basis. I don't have that number right in front of me, but if you send an email, we can try to get that number to you. I don't know if we can get the distribution of what the percentage of testing is done at different sites of service. But if you send that question, we'll try to see if we can get additional information to you on that item.
Thank you very much.
Good morning, Adele. Do we have any questions from Blackburn?
Yes, good morning, by the way. Maureen wanted me to ask about the outbreak at George P. Vanier. There's cases in 5 different classes there. And I know in the past, Doctor, you've mentioned that, the rapid testing is something that you would only use in specific circumstances. I guess my question to you is, would this outbreak at George P. Vanier not be perhaps a really good example of a place where it might work?
Well, we always keep our options open at the Public Health Service. Anytime one orders a test, you have to consider how accurate that test might be, and the overall performance of the rapid test is quite a bit less than the PCR test. The second issue is that when you test a population of people and you get a positive result, you have to be reasonably sure that that positive result is because the person is actually infected with COVID as opposed to having an erroneous test. So as a general public health measure, we only order screening tests when we think that there's a high likelihood that the test is going to be accurate. Based on the facts and circumstances that we have at the current time, we're not prepared to recommend rapid testing except in the most limited of circumstances. I think that if testing, without speaking to any specific outbreak, there are times where we may order widespread testing, and widespread testing, my preference would be to use the PCR test, which is more accurate than the rapid testing.
Thank you. The other question I had for you is, as you know, Premier Doug Ford is in the region today. He's going to tour the mass vaccination clinic at the mall, and he's going to make an announcement in Tecumseh. And I wanted to ask you, there's been a lot of speculation lately that he will move the province out of step 3 in the reopening Ontario plan. And I wanted to ask you if you have any reservations about the possibility of a decision like that.
Well, it's the premier and the minister's responsibility, and the provincial government's responsibility to try to formulate a province-wide approach to managing COVID-19. The decisions have to be made on the basis of the evidence that's available to us. So I'm not cognizant of the nature of the announcement at 1:30, but we wait and see what the premier and the minister will announce, and we try to provide the best possible guidance that we can related to the local situation to the people of Windsor-Essex as well.
So I'm going to assume then that you've had discussions with the province then about when we would perhaps, if not today, then when we do move out of step 3.
Yeah, I don't really want to comment on my private dialogue with my colleagues at the medical officers of health that do meet on a regular basis and have dialogue, and they share their guidance and recommendations through to the province through various channels. So I think what we have to do at this point is to wait and see what the announcement today at 1:30 is from the minister and the premier.
Okay, thank you very much.
If I could just interrupt a moment, Rob, back to your question around the school. Students are back in school as of last Thursday.
Thank you.
Any follow-up questions from Windsor Star?
No, thank
AM 800, any additional questions?
No, thank you.
CTV?
No, thank you.
Any follow-up questions from CBC?
No, thank you.
And any additional questions from Blackburn?
Nope, I'm good. Thank you.
All right. Thank you very much, everybody. We will wrap up today's session. We will meet again on Wednesday morning.
Thank you.
Thank you.
Thank you.
Have a good day.